There are approximately 1,000 known microplastics that can absolutely, without question, wreak havoc on your hormone function. So what's going on, ladies and gentlemen? Welcome again to Wednesday's Wisdom Session. I'm Dr. Patello, happy to be with you here. Welcome to all the new people who've been joining the group. Excited for all of you here. Excited for everybody who's logging on right now. And again, I want to say welcome to everybody. Thank you for being here. Thank you for participating in the group. We always check out your comments. So glad that you guys are participating and making this part of your community. I think this is going to be a good one here tonight. I want to say that it's kind of enlightening, so to speak. Wednesday's wisdom session is tonight's session is kind of cathartic for me. And what I want to do is I want to take this topic here, and it's something that I've been seeing in practice, and I see it so often in practice, and I want to bring this to you here this evening, and what hopefully is going to be something that you can start taking action on. You know, every single week I sit down and I have time set aside, and what I do is I'm able to spend some time with the medical literature. Actually, if you guys look over here in our post that we have, you'll see a reference source. Please take a look at that, because that's what we're going to be talking about here this evening. That is my job to do. I hope your doctors are talking about you and they are sharing this kind of information with you. If they're not sharing this kind of information with you, that probably should make you ask and wonder why they're not doing that. But what it's finding is, and what I want to show you is something that's different, something that's been happening in the research, and I want to show you here this evening, that we actually have an opportunity to actually implement, that you can implement and help you to start reversing your diabetes, because that's, after all, what this group is about, what we're all about here, and that's reversal. You know, in the standard of care, the model that so many of you are in, that you're stuck in, what I call the minimum standard of care that's out there. Diabetes is what? It's a progressive, it's a degenerative condition that gets worse over time, not better over time for people. And this is why we see so many people with medications on their medication list. It's just medication after medication after medication after medication after medication. And it usually starts off with things like metformin. And then it ended up progressing to things like glipizide and Januvia, and then all the injectables, and then it's et cetera, et cetera, et cetera, et cetera. And this week, I've met with so many different patients, and they share a common story, a common feature. And I want to talk about that here with you, because I'm seeing it in practice. If it means that I'm seeing it in practice, there are other people just like you who are probably dealing with these issues as well, or at least most of the time, and you're not even realizing that's the case. So what I want to talk about is I love running a specific type of comprehensive lab testing, and it's a tox panel, and we run it on a lot of our patients. And it's a way for me to see what's happening inside of their body that's not supposed to be there, what's driving their problems, what's not being addressed by the basic medical approach that's out there. Because after all, if you can't heal, you know, the edges of a cut together, why can't you, you know, if you could do that, like if you cut your finger, you can heal from that. Why can't you heal the edges of a metabolic cut, right? Does that make sense? Hopefully it does. Like if you were to cut your hand today, or if I did, I should say, if I went and cut my hand today and I went to the hospital, they'd probably stitch me up and maybe put a bandage on there. And then what would happen is I would heal. My wound would expect to heal. Like if I went back to the hospital 6 months from now, my hand wasn't healing, it was still bleeding. That would be really weird, right? There's not a doctor probably on the planet that would say, well, sir, you know what, you have a chronic wound. No way, right? Like that's just not possible. You never hear that, because you'd expect that to heal. Well, if that same heel can cut, right? If that cut was bleeding 6 months later from now, the doctors would immediately, what do they do? They're going to question me. They're going to question my lifestyle. They want to know, why is it still bleeding? They want to know why. Why does it keep opening up? The same cut every single day. And this is how I look at diabetes. And this is how your body was actually designed to heal. When it doesn't, there's got to be a reason for it, right? Because your body was meant to heal. You've been told that you have this chronic degenerative progressive disease that won't heal. So anyway, that brings me back to what we want to talk about. And what I've been seeing lately with patients, and have been for quite some time, but in particular this week, this really brought this to my attention. And many of you I know are you're dealing with the same issues, like you're trying to lose weight, but you can't. And what do? That you're trying to eat well, to at least the best that you know how, and you're just absolutely not getting any results, none, right? And then, you know, you're trying to exercise like your doctor is telling you, maybe it's 5,000, 10,000 steps a day, if you can do that, right? Most of you are fatigued, tired, you can't do that. You're doing all the right things, or at least the things that you know how to do. And yet every time that you go back to the doctor's office, they just give you a new prescription. They give you a new dose, and you get a Band-Aid. You get a Band-Aid to try. And that Band-Aid is there to cover up this metabolic wound that we talked about. And that metabolic wound is diabetes. So this week, what I saw here in these talks panels was a sequence of polymers, these plastic polymers, and they're residues from the body trying to metabolize the plastic. See, this is crazy because plastics are used as preservatives, right? And many different cosmetic products, shampoos, lotions, medications even. And get this, most of your favorite foods. See, what happens is plastics are used to preserve food. So it sits on the shelf at a place like Target so they can sell it, right? So it just sits there and it's being preserved. Those preservatives end up in your belly through your digestive tract, of course, and then from your digestive tract into your bloodstream. And then most people have no idea that this is even happening. They have no idea because the symptoms of plastic intake have been banned, been blamed for other issues. Usually it's the patient that gets blamed for things like, oh, you're just being lazy, you're not exercising enough, you're eating too many calories. So people eat these plastics in the food and put them in their bodies with their personal care products. And sometimes even in their medications like we talked about. And a certain set of results are always going to follow. And guess, or at least want to take a guess what they are? These plastics are super common in products that most Americans use. Want conditions that develop as a result of this, especially when we talk about here in America. And it's absolutely happening here at a faster rate than any other nation in the world, by the way. Can you take a guess what some of those are? Yeah, you guys are probably guessing it, right? Things like obesity, type 2 diabetes, cardiovascular disease, and all of these associated side effects, they have three massive conditions. And the reason is that these reasons why this is happening, the medical literature is clear on this. It's explained in the medical literature. The obesity, the type 2 diabetes, the cardiovascular disease, they're so common and they're found with people who have had plastic exposures. And this plastics are known as endocrine disruptors. Endocrine disruptors. If you've been following me for any period of time, you know I talk often about endocrine disruptors. They force your body to express an environment that perpetuates these three diseases. These endocrine disruptors, write that down. I want you to write that word down. Endocrine disruptors. Diabetes, obesity, those are endocrine-based conditions. And cardiovascular disease, being an inflammatory issue, certainly follows those hormones that are driving it. So I want to give you a couple of these chemical names here that you should be aware of, and that's what tonight's session is about, because I want you to watch out for them. I want you to try to avoid these the best of your ability. These endocrine disruptors that I want to talk about, these plastics, they'll put a healthy person really in a tailspin, right? And it's not like you're a diabetic and therefore you've collected plastics, right? No, people collecting plastics in their body end up developing diabetes. The plastics are interrupting their endocrine function, how your body's actually able to regulate blood sugar. And that's what they do, unfortunately. It's a cause, not a consequence of diabetes. So the first one I want to talk about, maybe many of you already know, it's called BPA. And it's a plastic that's been banned for use. Even by the FDA, they recognized that they couldn't allow it to be in circulation in really in good consciousness. Think about that for a second. BPA was banned over a decade ago, but I still see it in patients now every single week, right? We see BPA toxicity levels on these tox panels. Considering the fact that avoiding BPA exposure is one thing, but detoxifying from your body is completely another. And again, remember, like I just shared with you, it's been banned 10 years ago. Plastics are part of a family called forever chemicals. And you could probably guess, why do they call it forever chemicals? The literature tells us it takes forever for it to break down. So avoidance is good. It's a good thing to do, but removing it from your physiology, removing it from your body is absolutely critically important. BPA shows up because people used to drink out of plastic water bottles, and those plastic water bottles had BPA, and the plastic would leach out from the water and into the water, and the water that you were drinking. BPA was used in packaging for food. BPA was used for things like waterproof applications. It was like a super popular chemical until somebody started asking questions about all these crazy diseases that started showing up. So now they're not allowed to use BPA. So the FDA banned it. But what about all of the BPA cousins that you need to know about? See, the FDA has rules around BPA, but not any of them associated with chemicals that are just as horrible, just as horrible. For instance, another chemical, another common plastic that we find in these tox panels is something that I want to share with you. It's called 4-nonylphenol. And you should be looking for these things, 4-nonylphenol. And again, it'll be in the article that I'm sharing with you here, but again, 4-nonylphenol, same story. It's a plastic that you take in and you take it into your body, and you can put it in on your skin, right, with different things that you're using, and it drives endocrine changes, and it promotes obesity, it promotes diabetes, and of course, it's going to promote cardiovascular disease. 4-nonylphenol is a BPA's, I'll call it a crazy cousin. And at least the FDA is on the case with some of these chemicals. Like, thank God they put some of the measures in place that they were able to curb some of the production of them, helpful moving forward, right? But not for those who've already had the exposures, not for those of you who already have high levels of these toxicities inside of your body. And they are driving your endocrine issues. They're driving chronic disease. They're driving to you where you are right now, and then wondering why, gee, I'm doing all this stuff, and how come my numbers don't look any better? Must be me. I must be just a medical mystery. No, it's what I'm talking about here. It's one of the many causes, many reasons why this has happened. So let's talk about the next one. The next one I want to talk about oftentimes is associated with something called fibromyalgia. Many of you know this, right? You have all these aches and pains, and they don't know where it's coming from, and they just say, oh, you must have fibromyalgia. Not only does it cause fibromyalgia, it's going to cause diabetes. It's going to cause obesity. This is one of the commonly most found in things like personal care products, like lotions and makeup. Big time, this always shows up, and they are called phthalates, right? Phthalates. And if I had if I had a penny every time somebody came back with phthalates on their tox panel, I just want to let you guys know right now, I would have a lot of pennies, right? I would, because it's absolutely crazy. You can go to any bottle of shampoo in your house, or if you're at the store and you're considering buying some of this, the lotions, I want you to take a look. I want you to read that label, right? And you're going to find the word phthalates, right? PHTHALATES. I hope I spelled that correct, but phthalates. You can hit stop and record and replay this record, but they're called phthalates, and phthalates are present in these plastics and in these products that you might be using. It's another plastic that is a monster endocrine disruptor that's being used daily, and you don't know about it. Nobody's telling you. They're just telling you to eat less, chain yourself to the treadmill, and like, honestly, how are you going to outwork a chemical problem if this is one of the reasons why your diabetes is being driven? Like, you can't. It's like taking NyQuil every day, and your doctor is just telling you you need to figure out how to get more energy. You won't, right? Well, maybe you should jog a little faster. Well, you can't, because you're taking the NyQuil. You're not going to outwork a chemical-driven issue, guys. I want you to hear that. You will not outwork a chemically driven issue. Avoidance is helpful, especially if you're in the beginning of the healing process. But again, detoxifying these things are absolutely critical. It is king. So what happens to a patient as they begin to remove these endocrine disruptors, and you start removing it from your body, and obviously avoiding it, taking in any more? It's really remarkable. It's just like when you stop scraping the same cut on your hand every day. Like my story in the beginning, right? If I stop opening up that wound, it stops bleeding. Now, obviously, there's different mechanisms, but for sure, the principle is the same. All right, I'll say those 3 plastics one more time, so you guys definitely can write them down if anybody missed it that are jumping on. And again, you can watch this recording afterwards. Number 1, without question, is definitely watch out for BPA. BPA. Number 2, make sure you're looking for something called 4-nonylphenol. Any products that you might be using that has that word 4-nonylphenol, avoid it. Number 3 is something called phthalates. They're all endocrine disruptors. They're chemical drivers of things like obesity, diabetes, cardiovascular disease. Make sure you write them down. Make sure you arm yourself with this kind of information. Make sure that you start acting as an advocate for your own health, because truthfully, who else is going to? All right, we're gonna go ahead and wrap it up for tonight. But if you guys want more information like this, or if you feel like a friend or a family member can use this kind of information, make sure they follow the group. There's obviously, this is a free group, free information that I'm sharing with you here. Make sure they get this information. Make sure that you tell them about that. Make sure that they get registered for our next upcoming masterclass when we have that scheduled. We'll take a deep dive on topics like this so that you know exactly what you need to look at, what you need to do to be able to put this all in place together and help you live a diabetes-free life, because that is what we talk about here.